Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, doctor. I've been feeling some discomfort in my back for a while now.
Good morning. I'm sorry to hear that. Can you describe the nature of the discomfort? Is it a sharp pain, a dull ache, or a stiffness?
It's mostly a dull ache, doctor, and I've noticed that my posture seems a bit off. My family says one of my shoulders seems higher than the other.
That's a noteworthy observation. How long have you noticed these changes in your posture and the discomfort?
I think it's been about a year, but the discomfort has increased in the past few months.
Do you recall any specific injury or trauma that might have triggered this? Or perhaps any activities that put strain on your back?
Not that I can recall, doctor. I've always been quite active, but I haven't had any significant injuries.
All right. How old are you currently?
I'm 17 years old.
Do you have any family history of spinal deformities or scoliosis?
Yes, my older sister was diagnosed with scoliosis when she was around my age.
I see. It's important to know that scoliosis can sometimes run in families. Have you experienced any difficulty breathing or chest discomfort?
No, not really. Just the back discomfort.
Have you noticed any changes in your gait or the way you walk? Any numbness or tingling in your legs?
Sometimes my legs do feel a bit numb after sitting for long periods.
Okay, based on the physical examination, I can see a curvature in your spine and an asymmetry in your shoulder heights, which suggests scoliosis. However, we'll need some radiographic studies to confirm the diagnosis and determine the severity. An X-ray of the spine will give us a clear picture.
All right, doctor. If it is scoliosis, what will be the treatment?
The treatment for scoliosis varies depending on the severity and the type. Mild cases might just require regular monitoring and physical therapy, while more severe cases might need bracing or even surgery. We'll discuss the best course of action once we have the X-ray results.
I understand. Is there anything I should avoid doing in the meantime?
It's best to avoid heavy lifting or any activities that could strain your back further. But don't limit your mobility entirely. Gentle exercises can be beneficial.
Thank you, doctor. I appreciate your guidance.
You're welcome. We'll schedule the X-ray and go from there. Remember, early detection and intervention are key, so you're taking the right steps by addressing this now.
Extract 2, questions 13 to 24. For questions 13 to 24, Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, tell me about the symptoms you've been experiencing lately.
Thank you for seeing me, doctor. Over the past year, I've started to notice some changes. My periods have become irregular, sometimes missing a month or two, and then returning. Additionally, I've been experiencing hot flashes, especially during the night, which interrupt my sleep. It's like a sudden, intense warmth that covers my whole body, and it's quite uncomfortable.
I understand how distressing that can be. Have you noticed any other physical or emotional changes?
Yes, doctor. I've also noticed mood swings and increased irritability. Some days I feel perfectly fine, and on other days I feel overwhelmed with emotions, even tearing up over small things. My skin has become drier, and I've also experienced a decrease in my libido, which has been affecting my relationship with my husband.
It's quite common for women going through menopause to experience these symptoms. Have you experienced any vaginal dryness or discomfort during intercourse?
Yes, unfortunately. Intimacy has become uncomfortable due to the dryness, and sometimes there's even a bit of pain. I've tried over-the-counter lubricants, but they only provide temporary relief.
Thank you for sharing that. It's important for us to understand the full extent of your symptoms. Have you noticed any changes in your cognitive function, like memory lapses or difficulty concentrating?
Indeed, I sometimes find myself forgetting simple things, like where I left my keys or appointments I've made. Concentrating on tasks at work has become harder, and I get easily distracted. It's unlike me, and it's been a bit concerning.
These cognitive changes can also be a part of the menopausal transition. With regards to your sleep, apart from the hot flashes, do you experience any other disturbances?
Yes, I often find it hard to fall asleep, and when I do, I wake up multiple times during the night. Some nights I barely get 4 hours of continuous sleep. This, coupled with the night sweats, leaves me feeling exhausted during the day.
I can imagine how tiring that must be. Have you tried any remedies or treatments for these symptoms so far?
I've tried herbal supplements like black cohosh and evening primrose oil, as some of my friends recommended them. They seemed to help a bit initially, but the relief was temporary. I also tried yoga and meditation to manage my mood swings and stress.
It's good that you've been proactive in seeking solutions. Given the range and intensity of your symptoms, it might be worth considering hormone replacement therapy or other treatments. We can discuss the risks and benefits and see if it's right for you.
I've heard about HRT, but have been hesitant due to the potential side effects. I'd appreciate more information and guidance on this. Thank you, doctor, for understanding and being patient.
Of course, it's essential to be informed and make the best decision for your well-being. Let's discuss the options in detail.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
How did you feel about the cleaning procedure with Mrs. Thompson?
I felt it went smoothly, but I did struggle a bit with the ultrasonic scaler around her lower molars. I'm still trying to get the hang of it with tighter spaces.
I noticed that. Remember, in tighter spaces, angling the tip more towards the tooth surface can help. Did you feel you addressed her gum bleeding adequately?
I did explain that her gums were inflamed, but maybe I could have emphasized more on the importance of flossing daily.
Exactly. Patients often need reminders about the long-term benefits of daily flossing, especially when they experience gum bleeding. It's a teachable moment, so always capitalize on it.
Now look at question 26.
We have 15 MRIs and 10 CT scans scheduled for today, and we're short-staffed with only 3 technicians.
Right? Let's prioritize the MRIs for patients needing surgical planning first. They'll need their results quickly. We can slot the CTs around them, especially since they're faster.
That sounds like a plan. I'll handle the MRIs for the surgical patients. Can you manage the CTs and other MRIs?
Absolutely. Also, let's make sure we coordinate with the nurses for any patients needing contrast. We'll need to ensure they have their blood tests done before the scan.
Great point. I'll inform the nursing team right away. Let's make this work.
Now look at question 27.
Hello, I'm Jane, and I've just had my first baby. I've been getting so many different pieces of advice about feeding, and I'm honestly a bit overwhelmed.
Congratulations on your new baby, Jane. I understand how confusing it can be with so much information out there. I'm here to provide evidence-based recommendations and help you navigate this journey. Tell me, have you decided on breast milk, formula, or a combination of both?
I've been trying to breastfeed, but I'm not sure if my baby is getting enough. Some friends suggested I supplement with formula just to be sure.
It's a common concern for many new mothers. The best way to determine if your baby is getting enough is to monitor their weight gain and diaper output. If your baby is gaining weight and has regular wet and dirty diapers, they're likely getting enough. However, if you choose to supplement, or if there are any concerns, it's essential to do so safely and in consultation with a pediatrician.
That's reassuring to hear. I'll keep an eye on those signs. Thank you for your guidance.
Now look at question 28.
Good morning. I'm John, the physical therapist assigned to assist with your post-surgical rehabilitation. How's your knee feeling today?
Morning, John. It's a bit sore and stiff, especially in the mornings. I'm quite worried about the pain during our sessions.
It's normal to feel some discomfort, especially after a surgery. Our goal here is to gradually improve your knee's mobility and strength without causing undue pain. We'll always adjust our exercises based on your comfort level. Remember, communication is key.
I appreciate that. I've heard that consistent physical therapy can really make a difference in recovery. I'm committed to the process.
Absolutely. With dedication and consistent sessions, you'll be back to your regular activities in no time. We'll work together to ensure the best possible outcome for your knee.
Now look at question 29.
I was reviewing Mrs. Smith's chart and noticed she's on IV fluids. I'm still getting the hang of fluid management. Can you help me understand the rationale behind her current regimen?
Of course. So Mrs. Smith is on a maintenance IV fluid because she's currently nil by mouth due to her upcoming procedure. Are you familiar with the 4-2-1 rule for fluid calculations?
I've heard of it, but haven't used it practically.
No worries. It's a method to calculate the hourly maintenance fluid requirement. 4 millikilograms for the first 10 kilograms of body weight, then 2 millikilograms for the next 10 kilograms, and finally 1 millikilograms for the remaining weight. We use this as a baseline and adjust based on the patient's clinical status and lab results.
Got it. I'll make sure to apply this rule when reviewing her fluid status. Thanks for the guidance.
Now look at question 30.
Hi there. I've been feeling quite fatigued lately and read online that certain supplements might help. What would you recommend?
Hello. There are indeed several dietary supplements that people take for fatigue, but it's essential to first rule out any medical conditions. Have you seen a doctor about your fatigue?
Not yet, but I wanted to see if there's something over the counter I can take in the meantime.
I'd always recommend seeing a doctor first, but in the meantime, some people find that B vitamins, magnesium, and iron can help with fatigue. However, it's crucial not to take excessive amounts as they can have side effects. It would be best to ensure you're getting the right dosage and that they won't interact with any other medications you might be on.
Thank you for the advice. I'll consult with my doctor and then decide on the supplements.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
In my years as a medical professional and advocate, few health issues have been as socially and emotionally charged as HIV/AIDS. It is a topic not only of biological significance, but of vast social and personal ramifications. The power of narratives in shedding light on this global epidemic cannot be understated. Take the case of Miriam, a 25-year-old woman from sub-Saharan Africa. When she was diagnosed with HIV in the late 1990s, the region was in the throes of the epidemic. Amid societal stigma, Miriam felt her world crumble. With no access to antiretroviral treatments and limited understanding of the disease, her prognosis seemed grim. However, in 2005, through the support of international aid organizations, Miriam received her first dose of life-saving medication. The change was nothing short of miraculous. Today, she is an advocate for HIV awareness and prevention in her community. This narrative, while heartwarming, is emblematic of the transformative power of global healthcare interventions. It reminds us of the individual lives behind the staggering statistics. For every million people living with HIV, there is a million unique stories. In my earlier work, I had explored the sociological implications of pandemics. The broader context of HIV/AIDS as a disease was not just its virology, but the narrative of the communities it affected. It's a story of disparities, where in some parts of the world, a diagnosis was a death sentence, while in others, it became a manageable condition. When I presented these narratives at medical conferences, fellow professionals would often approach me, sharing their own experiences. A nurse from San Francisco recalled the early days of the epidemic in the US, painting a haunting image of the sheer number of young men she saw withering away, their stories untold. Another doctor from India spoke of the myriad cultural barriers that made HIV/AIDS discussions taboo, further complicating the fight against its spread. However, narratives can sometimes lead to generalizations. A poignant tale of a child born with HIV in a developing nation might unintentionally overshadow the story of a middle-aged individual coping with the same in a first-world country. It is crucial to remember that each story is a piece of the larger puzzle, but no single narrative can represent the entirety of the HIV/AIDS experience. Moreover, while individual stories are compelling, they should not divert attention from the empirical data and research that drive medical advancements. The introduction of antiretroviral therapy, for instance, was not just a chapter in the story, but a turning point in the fight against HIV/AIDS. Its efficacy and widespread adoption were rooted in robust clinical trials and evidence. In the realm of healthcare, especially with HIV/AIDS, stories and statistics should coexist. They offer complementary insights. While randomized trials, meta-analyses, and cohort studies provide us with generalized outcomes and patterns, narratives grant texture and depth, making the data come alive. The HIV/AIDS epidemic is both a scientific challenge and a human tragedy. As we inch closer to potential cures or vaccines, we mustn't lose sight of the stories of those affected. Their narratives remind us of our shared humanity and the profound impact of healthcare interventions. In sum, as with all facets of medicine, the art of storytelling, when intertwined with the robustness of scientific research, offers a comprehensive view, ensuring that the individual remains at the heart of all medical endeavors. We owe it to Miriam and countless others to remember and share their stories as we forge ahead in our fight against HIV/AIDS.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon. My name's Alex Thompson. I'm a junior doctor here at the Medical Center. Today, I will be sharing information on a topic that is increasingly relevant in our aging population: dementia. Though I'm not a specialist in neurology, I've always been intrigued by the complexity of the human brain and how age-related conditions like dementia affect it. I'd like to take this opportunity to shed some light on this matter. First and foremost, what is dementia? Dementia is not a singular disease, but rather an umbrella term used to describe a range of symptoms associated with cognitive decline, like memory loss or thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease accounts for 60 to 80% of cases, making it the most well-known and prevalent form of dementia. Why is understanding dementia so essential? The impact of dementia goes beyond the individual. It has significant implications for families, caregivers, and our healthcare system. With an aging global population, the incidence of dementia is expected to rise dramatically. A frequently asked question is, how is dementia different from the typical memory lapses we all have? Forgetting names occasionally or misplacing the house keys is normal. But dementia involves more severe impairments like forgetting recently learned information, getting lost in familiar places, or struggling with vocabulary. So what causes dementia? It results from damaged brain cells. When the brain cells are impaired, they can't communicate effectively, leading to dysfunction. Different types of dementia are associated with specific kinds of cell damage in various brain regions. Risk factors include age, family history, certain genes, and other conditions like high blood pressure, high cholesterol, and diabetes. A good rule of thumb for maintaining brain health is, what's good for your heart is good for your brain. There is no definitive cure for dementia currently. However, treatments are available to alleviate symptoms. Medications like cholinesterase inhibitors and memantine can be prescribed. Non-drug treatments such as cognitive stimulation therapy and reminiscence therapy have also shown benefits. An exciting area of research is early detection. Scientists are exploring biomarkers, brain imaging, and cognitive assessments to detect dementia in its nascent stages when interventions might be more effective. The societal cost of dementia is staggering. Caregiving, especially in advanced stages, can be physically and emotionally taxing. Support systems for caregivers like counseling and respite care are vital. In closing, the challenges dementia presents are monumental, but with growing awareness, focused research, and community support, there's hope for better care and eventual solutions. As our society continues to age, it's incumbent upon us to better understand dementia, not just as healthcare professionals, but also as community members, to provide empathy, support, and care to those affected. Thank you for your attention, and I hope this provides a comprehensive overview of dementia and its significance in today's healthcare landscape.